computer.
Hey,
Good
Michelle.
morning, welcome.
Good evening. Good evening.
Dr. Cronin, we're gonna start now.
Okay.
Welcome, as you're coming in, please mute yourself. We have a guest in our midst today. We have the Department of Health. Representing them is Mr. Steven Rodriguez. He's a community coordinator with the New York City Department of Health and Mental Hygiene with over 7 years of experience as a public health professional. He is passionate about advocating for and providing essential services and resources to underserved communities. With a focus on health equity, he works to bridge the gap in across the sphere and improve the well-being of population that he serves. So join me, Relume Foundation, and all of our guests, join me to welcome Mr. Rodriguez, who's going to be talking about tuberculosis today. Mr. Rodriguez, thank you so much for coming.
Thank you. Good evening, everybody. Thank you for having me this evening, and thank you for joining. For those of you that are here, that was a good introduction. Thank you. So yeah, today we're here to talk about tuberculosis. The reason why we're here, is to raise awareness, also because there has been a rise in cases, particularly to New York City, as well as Queens. We've been seeing a big rise in the number of cases. So today, this is a very basic training. I'm going to talk about a little bit what tuberculosis is, symptoms, how to get tested, and some resources that we have as well. And yeah, if you guys have any questions, you can type it in the chat, or you can ask the question or interrupt me, or you can wait till then. I'll leave time at the end for questions as well. So today you're going to learn about tuberculosis, how it is transmitted, who's affected in New York City, how is it diagnosed and treated, what can you do to prevent tuberculosis in your community, and how can you educate your community about tuberculosis. And this is our agenda. Again, talking about tuberculosis, the two types of tuberculosis, how it's transmitted, what are some of the symptoms. We know that some of the symptoms are similar to other diseases, so it's good to recognize what these symptoms are and encourage people to get tested just to be able to determine what type of disease or any other disease that they may have. We're going to talk about how it's diagnosed, some of the treatment options, what can you do to prevent it, and some of the resources that the health department has. So what is TB? TB is a serious disease caused by bacteria. So normally when a person who is sick with tuberculosis coughs, sneezes, sings, or speaks, they release germs into the air. A person nearby may breathe in the germs. If the germs get into their lungs and are not killed by the immune system, the person becomes infected. Today, we're mostly going to focus on tuberculosis that affects the lungs. That doesn't mean that tuberculosis doesn't happen in other parts of the body. It can start at the lungs and spread to other parts of your body or other organs, etc. But today, we're just going to focus on the lungs. This is some data in New York City with according to tuberculosis from 1984 to 2023. You can see my little arrow here. There was a big rise in tuberculosis in the late 80s to early 90s. You can see here there was a big number of cases in the 90s, and the reason for that is because at the same time there was other things going on, specifically HIV and AIDS. And also the crack epidemic as well. So, the injecting of drugs and sharing needles is another reason why tuberculosis was on the rise in the 90s. And when you look at the map going to 2020, you see that the numbers are going down a lot. And once you get to 2020, this was the lowest recorded number of cases. And, obviously that's because during 2020, we had the COVID-19 pandemic. And, during this time, a lot of people were social distancing. They were wearing masks. They were practicing things to keep each other safe. Also, I would say it could be a lot of people that were misdiagnosed because some of the symptoms are similar to COVID with tuberculosis. So that could be another reason why the numbers are so low in 2020. But then after 2020, you can see that the numbers are starting to rise again. You see in 2022 here, and then 2023 over here, the numbers are even higher than what they were pre-pandemic. So that's what we're concerned about, and that's why we're here and talking about this today. This map here shows the number of tuberculosis cases, rates, and select characteristics by patient country of birth in New York City in 2023. So, for example, these 5 countries listed on the map here: Mexico, United States, Ecuador, Bangladesh, and China. The first one here, Mexico. So 31 of the cases in New York City in 2023 that had tuberculosis, they were born in Mexico. 72 of those cases of tuberculosis cases were people that were born in the United States. 51 of those people were born in Ecuador. 36 were born in Bangladesh, and 129 were in China. And these are the top 5 countries of birth by NYC tuberculosis burden and incidence in 2023. I know this is a little confusing, but the good thing to take away from this map is that in the darker shaded areas, like here in South America, you see darker shaded areas, Central America, Africa, and also in Asia. These are countries that have high rates of tuberculosis. So this is important for people that travel a lot. Also, this is good to know because we know that we've had a large wave of asylum seekers or migrants coming from other countries. So this is another reason why we believe that the numbers have been going up, because we've been having a lot of migrants coming to our city. Okay. Next, we're going to talk about TB transmission. So what are the risk factors? The source obviously is the person that's infected with active tuberculosis. What are the risk factors for environment? A room with poor ventilation, no windows, no air circulating. That's a risk factor for environment. Time frame. I get asked this a lot. You have to be exposed to a person infected with tuberculosis disease for a long period of time. We're talking about like a full work day, so about 7 to 8 hours minimum. This can be, people that you live with, friends, roommates, family. You spend a large amount of time at work as well. It could be if you spend a lot of time with a coworker that's infected, or schools as well, nursing homes, jails, stuff like that, etc. Places that you may spend a large period of your time at with someone that may be infected. And the risk factor, the main one for tuberculosis, is having a weak immune system. So people with like HIV or cancer, diabetes, or any other health concern are more susceptible to this disease. And these are some of the things that tuberculosis does not spread by. So number 1, shaking of hands or hugging, sharing of food or drinks, kissing, or like a short subway ride. So like, an hour or two commute to your job or school or whatever. That's not one of the ways that tuberculosis spreads. It has to be a large period of time. So now I'm going to talk about the 2 types of tuberculosis. So there's latent tuberculosis infection, or LTBI. This type of tuberculosis, the germs will stay in your lungs. They don't multiply and they don't make you sick. So a person with latent tuberculosis infection is not contagious. They don't have any symptoms. Their chest X-ray shows up as normal. And yeah, you can say that they do have the tuberculosis germs in their lungs, but they're kind of like just sleeping. They're just there, but they're not active and they're not contagious. As opposed to the second type of tuberculosis called active tuberculosis disease. Again, the germs stay in your body. The difference is that they do multiply and they do make you sick. So a person with active TB disease will show symptoms. Their chest X-ray will be abnormal, and they are contagious. So if tuberculosis infection or latent tuberculosis infection is not treated with medication, it can eventually turn into active tuberculosis disease. There's no real time frame on this. It can be days, weeks, months, years that it could stay dormant in your body and then turn into active TB disease. Tuberculosis, latent tuberculosis infection can turn into active tuberculosis disease more easily if the person has HIV, diabetes, or any other health problem that makes it hard for the body to fight germs. So like I said earlier, people with weaker immune systems are more susceptible to tuberculosis. And these are some of the differences I just spoke about: latent tuberculosis infection and active TB disease. The main difference is latent tuberculosis infection. You do have the germs in your body. They're not active. You don't feel sick. You don't have any symptoms. You cannot spread the germs. The only similarities between these between latent tuberculosis infection and active TB disease is the TST, which is the tuberculin skin test, and the QFT, which is the blood test. Oh, excuse me, sorry about that. Which is the blood test. They will show positive results. If you do, I'll talk about this a little bit more in the next few slides. But if you do show a positive results in either test, you have to follow up with your doctor to get a X-ray, a chest X-ray, or a medical evaluation. They both can be treated, although the treatment for active tuberculosis disease is a little bit more, what would I say, like you have to be on the medication for longer. And now we're going to talk about some of the symptoms of active tuberculosis disease. The main one I would say is the first one right here. So if you have a cough that doesn't go away and it gets worse, we say more than 3 weeks, and it's often accompanied with a lot of phlegm or blood, then yeah, we consider that one of the main symptoms of active tuberculosis disease. The other ones listed here, like having sweating at night, feeling tired all the time, loss of appetite, weight loss, fever, and chills. These are the same symptoms as like other diseases, like COVID, the flu, etc. It's just good to be aware of these symptoms, and if you do experience any of these symptoms, it's good, just to be safe to get tested, just to determine what exactly a person may have. Now I'm going to talk about testing. So who should get tested? Like I said earlier, if you spend a long time around someone with active TB disease, you should get tested. Whether it's someone at work or someone in the house that's infected, or someone at school, etc. It's good to get tested. If you traveled or lived in a country with high rates of TB, it's a good idea to get tested just to be safe. And again, people with certain medical conditions such as HIV or any condition that weakens the immune system should get tested regularly. And here at the bottom, disclaimer, you can still get tuberculosis even if you receive the tuberculosis vaccine, which is BCG or Bacille Calmette-Guerin. I'm probably mispronouncing it. But you can still get tuberculosis even if you have received the vaccine. Now I'm going to talk about diagnosis. So there are 4 basic tools in the diagnosis of tuberculosis. Number 1, your medical history. Number 2, the skin and blood test. Number 3 is the chest X-ray, if the blood test or the skin test is positive, and the bacteriological exam. So these are some tests to determine if a person has latent TB infection. Here on the left is the skin test, or the TST for short. You can see here, this is a 2-visit test. On your first visit, the doctor injects this tuberculin, this circular thing on your forearm. And then after 2 to 3 days, you have to come back, and your doctor has to measure if there's been any like reaction to the skin. They usually measure it, the length of it, and that's how they determine whether it's a negative or positive test. And then on the right here, it's a regular blood test. They draw your blood and they send your sample to the lab to get tested for tuberculosis. And again, if either of these show up as positive, a chest X-ray and medical evaluation will be necessary as a follow-up to determine whether it's latent tuberculosis infection or any other disease. So can the vaccine protect you from getting TB? The vaccine mostly protects infants from getting severe forms of TB. The effectiveness of the vaccine wanes over time, and no, it cannot protect you from getting infected. I'm not sure like if in the United States they provide this vaccine for adults, but I know like in other countries they do offer it when you're traveling. Specifically, like for me, for example, my parents are from the Dominican Republic, and before they came to the United States, they both got this vaccine. And you can tell when people have this vaccine because they usually have like a little stamp on their shoulder. So that's what the vaccine looks like. Now I'm going to talk about treatment. So treatment for LTBI includes medicine from your doctor to kill the germs. And this will stop you from getting active TB disease. Treatment, as opposed to treatment for active TB disease, which includes taking several medicines for at least 6 months. It's good to encourage people to get tested to see if maybe they have latent tuberculosis infection. And also to encourage them to get treatment as well, because I hear a lot, people will say like, oh, I feel fine, I don't feel sick, I don't have any symptoms. So that may make them not want to get treated, even though they may have these germs in their body. They may not even want to get tested to find out if they have it or not. So it's good to encourage anyone that you may think may be infected to get tested regularly, and if they do have this infection, encourage them to get treatment. So yeah, as opposed to active TB disease, like I said earlier, you take several medications for at least 6 months. After a few weeks of taking the medicine, you will no longer be able to spread the germs, and you have to wait for your doctor to tell you when you can return to work, school, and any other activities. So my recommendation, it's good to get this treated early before it can convert to active TB disease, because the medication for active TB disease is a little bit more severe. So tuberculosis disease is almost always curable, but medication must be taken even after you no longer feel sick. TB disease can be prevented by taking medication when you have TB infection. if your test results are positive for latent TB infection, we encourage you to get treated right away. And like I said earlier, some people may test positive and may not seek treatment right away just because, they say, I don't feel sick, I feel fine, uh, stuff like that. We recommend, just to encourage people to get treated and tested first and treated if they are positive right away. Now I'm going to talk about some of the health department CHEST centers and resources. These are some of educational material and data information as well. You can find a lot of this information on our website at nyc.gov. If you type in tuberculosis, a lot of this data is available and can be accessed by the public. There's also information on how to order some of this literature as well, if you guys are interested in that. There's some posters here I see, and just information and literature that you can read, and it's also available in several different languages as well. And here are some of the CHEST centers that the New York City Department of Health has. There's one in Queens and Corona, Junction Boulevard. We have one in the Bronx in Morrisania, and we have one in Brooklyn in Fort Greene. We had one in Manhattan and Washington Heights, but currently that location is closed. One thing I will say about this is that the New York City Department of Health, they will never ask for immigration status, or and they will treat you even if you have no medical insurance. So if you have clients that are, don't have papers, or you can encourage them to go here. They won't ask for any of that, and they can still get treated even if they have no health insurance. I know for those with no health insurance, there's a low to no cost fee. I don't know what that looks like, but I know these centers, they each have their own individual numbers. You can call them. I believe it's based on income, but I'm not 100% sure on that. So how can you prevent TB? And number one, like how I'm doing now, by increasing awareness and providing trainings to our community organizations in communities that may be at risk for this disease. Encouraging those with a cough to cover their mouth or wear a mask. You can encourage those with TB symptoms to see a doctor, to get tested. Encourage those that may be on treatment to take their medication, even if they say they don't feel sick or they feel fine. You have to encourage them to take their medication consistently. And lastly, encourage use of our free TB services provided by the New York City Department of Health. And I mean, that's basically it. This is a very basic training, straight to the point. Talks about what TB is, how it spreads, and yeah, basically just to raise awareness as compared to other diseases. So if anybody has a question, can ask now, or I'm going to provide my my contact information as well. You can email us as well if you don't have a question now, you have a question maybe comes up after this training. And yeah, these are some of the other trainings that are offered by our program. We're doing Tuberculosis 101. We also have Hypertension 101, Youth Suicide Prevention, Mental Health First Aid. We will be having fentanyl training starting in October. And I also wrote and more, because if there's any topics that you guys would like to be trained on, you can reach out to me. Please let us know. If we can provide that training, if we can get trained up and provide that training, we would be more than happy to. And also if we can't, and we have a resource that we can connect you with an organization or another resource that can provide you with that training that you would like.
Thank you so much,
You're welcome.
Stephen Rodriguez.
Mm.
If there are any questions, would you please raise your hand and I'll acknowledge you and unmute. Does anyone have any questions about what you've heard this evening? I'm sure there must be some question.
I have a question. I'm on my phone trying to raise my hand, but
Oh,
I
okay.
I, I
All
don't
right.
have really a question, but I just want to say I found it very informative, first of all. And of course, me being a little older, I was surprised to find out that even with the shot, you could still get it.
Yeah,
That's very surprising. I think a lot of people would be
You mean
surprised to
with the
know.
BCG?
Yeah, if you've had the vaccination, right?
Um,
According to what
yeah.
Mr. Rodriguez was saying, is that correct, Mr. Rodriguez?
yes, it can still get it even if you get the vaccine. I would say it protects you more against severe forms of tuberculosis.
Okay,
Kind of like, the COVID vaccine. Even if you got the vaccine, there's still a chance that you can still get COVID. Kind of similar to that.
right.
Um, but yeah, and again, like I said earlier, it does provide protection. You still can get tuberculosis. Um, I don't know, if, like I said earlier, if the United States provides this readily for like adults. I know they provide it for infants to protect them from severe forms of tuberculosis. But I do know, like in other countries, like my parents' place of birth in Dominican Republic, I know that they received this vaccine before they traveled here to the United States. So I don't know like how the United States handles
Yeah.
that.
Yeah, I can jump in
Yeah,
there.
yeah.
So in the US, the BCG vaccination is not generally recommended because we have a low risk of severe disseminated TB, and the BCG vaccine has variable efficacy. So there's a lot of studies out there in the countries that give the BCG vaccine, but it's generally given to infants who have not been exposed to the mycobacterium, and its efficacy in infants seems to be good, um, with variable results across the different studies across the different countries. But the vaccine wanes, and I think Mr. Rodriguez had a slide that showed that the efficacy of the vaccine wanes over time. So, as you get into maybe your teen years or approaching your teen years, it doesn't mean that you're protected. The vaccine's efficacy may not be there. But the other reason in the US is that we have a low overall risk of infection with TB. And then one of the other reasons, as a physician, is that the BCG interferes with the skin tests, okay, that we give for to see if anyone has been exposed to tuberculosis. So it has a confounding effect, especially because we're in the United States and our risk for tuberculosis is low. So when we do the Mantle, the skin test for tuberculosis, if someone has had the BCG, we can't effectively interpret that skin test. Okay, so because the vaccine itself will give that result as though someone has been exposed, which they have been, because the BCG vaccine is, I believe it's a live vaccine, a live bacterium vaccine. So those are the reasons that we don't use it in the US. So that's you know, if you've come from another country, maybe in the Caribbean or somewhere, as he mentioned, from the Dominican Republic, where there are higher rates of tuberculosis and a higher risk of acquiring tuberculosis infection, you would be given the vaccine as an infant. But, in the US, we have different, we don't have the same problem, so to speak, with tuberculosis. Okay, other questions? Any other questions that we have about tuberculosis?
So I just want to know, is there a special mask for protecting ourselves from the tuberculosis?
We
Or should we just use the
as,
regular mask?
as a healthcare provider, we probably should be using the N95 mask. When I was working in the hospital, we had someone suspected of tuberculosis and we had to attend to them. We always use the high filtration mask and not just a regular mask. Because, you yourself as a healthcare provider are exposed. So, you need to protect yourself if you are entering the room with someone with tuberculosis or, on treatment for tuberculosis. And I don't think
So
that we have those, back in when he showed that graph about the peaks of tuberculosis, that's when I was a fellow. And, we used to have isolation wards. Certain hospitals would have isolation wards, like at Kings County, for example. They had a special ward for tuberculosis that was, separate from the other wards. And there was a protocol, a procedure that you had to go through to enter into that ward. And, each room was separate and each room had a high filtration, so a high air turnover. There was just special precautions that you had to use, but we had to use, for someone diagnosed with tuberculosis, we had to use the like a KN95 mask. But I know you work in the ICU, and sometimes there are patients in the ICU that have been diagnosed with tuberculosis, and effectively those patients should be in a separate isolated room, even though if they're on a vent and that's a closed system, but when you have to suction that trach or do anything with that patient, then those germs are released to the air, so you have to take extra special precautions.
Can I say something, please?
Yes, surely.
All right. I'm glad when he thought about you come from the West Indies, and okay, when I came and I started a job, that job you had to go and take that test in your hand.
Yes.
Every year.
Yes.
I took it the first year, and it's kind of, it didn't swell, but it make the little mark. So they say, okay, go and get an x-ray, which I did. So the second year I went, and the doctor looked at it, and he said, okay, well, I didn't have to go for no x-ray. See, then the third year when I went, what he said to me, he said, you do not have tuberculosis. It's the germ of the tuberculosis in your blood that causes. And he gave me a letter to give to any doctor and to my job to say, that I do not have to take any X-rays because I do not have tuberculosis. It's a germ that was put into my body as a child, that is what was causing the raising of the thing.
Okay, so we cannot address any specific individuals,
And just a comment I'm
diagnoses
making.
or anything specific with their health. So,
I'm just making a comment.
yeah,
That's
yeah.
all.
Okay, yes.
Okay, thank you. But it's a very good program. Good to hear.
Okay.
All right, good.
Thank
All
you.
right. Any other questions or comments? Any other
I'd like to
thoughts?
also comment on the fact that
Yes.
it's good to know, because I think a lot of times people, when you see someone coughing, I think everyone does honestly think, oh my God, do they have COVID at this point? Or do they have TB? Let me get away as quickly as I can. But it's good to have the knowledge that it takes more than a train ride to to connect it to get the contact of it, or for it to be contagious. Because there are times when you can't help but be around people that are coughing at this point. You don't really know who has what. So thank you for sharing that information.
Yeah, this is why what the training is for, just to raise awareness, to not scare people, but just give facts, information, and so you can protect yourself, and be safe.
Yes.
But thank you for that comment.
Okay, if there are no further questions or comments on the topic of tuberculosis, then we can move on to COVID. And I know everyone on this platform is well informed and aware of COVID-19 and the long-term effects and what is happening now that the COVID rates are increased. The wastewater testing has shown that COVID is on the rise, the hospitalizations. But I think we talked about this the last time as well, is that we have the new booster or the new vaccine for COVID-19. It has been approved and is released. So with that being said, we are going to have our vaccine drive. Each year we do a COVID-19 vaccine drive, a COVID booster drive along with influenza and RSV. And this year the dates are October 24th, which is a Thursday, October 24th. And that drive will be held at the Robert Couch Senior Center. I believe last year we vaccinated roughly 60 people for COVID and influenza. And the second date that we are having is Sunday, October 27th at Foundation Church. And that will be for COVID, RSV, and influenza. The registration is required to be registered to obtain the vaccines. As you know, the vaccine has to be defrosted, etc. So we need to know how many people are coming before the event so that we can properly prepare, and as well have your insurance cards, your insurance information available, because the vaccines are no longer quote unquote free, but they are covered by insurance. So that is the news, the announcements, and the just on another note, we still are inviting people to send their children for one-on-one virtual tutoring, okay, from grades, I think it's grades 3 through 12.
Yes.
So, yes, so anyone whose children, your grandchildren, etc., need tutoring help in whatever subjects in school, we want all of our children to, to excel, to be excellent, but sometimes they need help because, as you know, these days it's not easy in the classroom, it's not easy in the schools. There's so many incidences happening as you listen to the news, and the despite what is going on, our children still need to be well educated in order to excel in their life going forward. So we have free tutoring, it's free, and it's one-on-one. And so we're asking that you spread the word and that you sign up your children, your grandchildren, whoever needs assistance with their education, the children's education. Very important to us. Okay, so I think those are the announcements that we have for tonight. Dr. Sherry, anything else?
Well, the only thing I will add to that, I don't know this is okay. Hold on 1 second. I don't know why the is stalling. Is Zoom is responding very slowly. Maybe it's from my hand. Hello, everyone. Can you guys still?
Yes.
Okay. So let me just share this other link with you for those that may want to say volunteer as a tutor. Sorry, guys.
David, come.
Hold on 1 second. I don't know. That can
Come, you need to read this. There's another thing that you need to write here.
Can you mean? Okay.
I don't know who that is.
Michelle. No, it's not Michelle. That's hold on 1 second. I'm not sure if you guys are seeing my screen. Can you guys see what are you seeing? You see the tutoring application?
Yes.
Yes.
Yeah, so this application, this one is for those that want to be a tutor, like you're a certified teacher or high school student, and you want to do a unique community service. So if you're a high school student, or if you know someone that's a high school student and they want to volunteer with our tutoring program, they can tutor a student, 1 student per week, and they get 2 hours of community service, 1 hour for preparing and 1 hour for the class itself. So yeah, if you want to support what we're doing, please feel free, scan the barcode and you can register. Everyone has to register. If you're a high school student, we need your transcript to ensure that you really pass the class you want to teach. So yeah, that is important. And the other flyer is for the students. So as we round up, if there's any comment, we'll take it, but we'd like to thank our presenter. Did they leave? Oh, they left. Okay. We'd like to thank them, but I think I did put something in the chat before they left, and I'll send them an email to thank them for coming to present today. Okay. So any other comment, Dr. Sunday, you want to say something? Dr. Crony, any other? It's been extended, yes. The cutoff has been extended. People can still, so with the tutoring, what we're doing is the registration is ongoing. So, but for those that registered up until September 22nd, they will get matched with a tutor by the end of September. So they will start the tutoring in October 15. So those that register after that will start their own about 2 or 3 weeks after. So every month we will roll in and bring in new students and new tutors. So yeah. Okay. Question, comment. Hello, everyone. Hi, Sister Pauline. Thank you for joining us. I see some new faces on the platform.
Hello, Sister Sherry.
How are you, Nicole? How are you doing?
I'm good. Thank you.
Okay, great. Hi, oh, nice to see your face. All the way from North Carolina, Miss Hunter.
I'm right here.
Who is T Shrink? I don't know who that person is. Hi, welcome. Thank you for joining us. Hi, Michelle. Oh, Sister Mary is just coming on.
You want to stop the recording, Sherry?
Yeah, I did the record. Oh, I didn't stop it. Oh.